Hello everybody and welcome to the Daily Splatt. Yes, I'm back. Hello, how's it going? Yeah, so everything is returned. I'm planning on picking these up once more, and I'm hoping that you will all find it enjoyable in some respect. Now then, today I thought it was important to kick things off with something of an important message. This is February, in case you haven't noticed. The month is, that is, and in the cancer department, in the cancer services in the health department here in WA, Western Australia, not Washington, it's Ovarian Cancer Awareness Month, which is basically, we do Cancer Awareness Months because I work for the WACPC and the West Australian Palliative Cancer and Care Network as one of my jobs, and yeah, we do a lot of cancer awareness drives and things of that nature, and this month is the Ovarian Cancer Awareness Month. Now, I'm normally supportive of these drives, whether it be breast cancer awareness, prostate cancer, skin cancer, they're all good services to get behind, because if you buy one of those little ribbons and stuff, I have seen that money goes to good places. I've had to laminate the paperwork that confirms where it goes, so yeah, it does all go to good causes. But in particular, I wanted to push the ovarian cancer awareness for two reasons. Reason number one being that ovarian cancer is very difficult to detect. The ovaries, for the uneducated, are located inside a lady's body, in the middly bit. I'm not a doctor. And the fact is that the symptoms for ovarian cancer are often quite hard to tell from symptoms to other things, where people can feel bloated or suffering cramp in the areas or things of that nature. The problem is the symptoms are very easy to confuse for symptoms for other things, so a lot of people don't find out they have ovarian cancer until it's in a later stage. Obviously stage 1 and stage 2, when it's caught very early on, is very survivable, but once you get beyond those stages and to the time when people normally find out they have ovarian cancer, sometimes it's spread to other areas of the body, and it essentially just becomes a case of trying to last as long as you can, as opposed to beating the disease. So ovarian cancer is particularly nasty in that way, and I think it's a really important thing to get behind spotting. So reason number one for me doing this. Reason number two is I have a friend who is currently is about to be receiving treatment for ovarian cancer. Now, luckily for her, it's one of the early stages. She found it early, which it must have taken remarkable intuition and knowledge of her own body to realise that it was a possibility, and some people had told her that it might not be, but she got it checked out, they found out it was this, and now she's getting herself sorted out and has promising chances of recovery. So obviously it's a difficult time for her, and for people that know her, of course, it's important to support her, and it's important to support anyone suffering any form of cancer. I had a neighbour who last year was diagnosed with bowel cancer, but fortunately that has been treated and they are now fine. So cancer is prevalent in the community, and we've got to do what we can to try and sort it out. Now then, so basically all I'm saying is, if you see the teal ribbons available for a small donation of coin, I'd encourage you to go get one, because they are obviously the money goes towards good causes, helping out obviously all sorts of things, services for the patients, trying to actually find a cure for the bloody thing, things like that. So there you go, that is my message today. Just be aware of ovarian cancer, and of course, ladies, educate yourselves. And in fact, blokes, educate yourselves as well, because it's always good to know these things. But, you know, ladies in particular, you know, please learn about this. It's very important that you do. It is a cancer that tends to affect women later in their life, from sort of the mid-40s onwards, but not always. My friend, who is actually much younger than that, you know, late 20s, early 30s, is where she is. So, you know, it can strike at any time. So, yeah, keep an eye on it. Right, that was nice and serious way to get back into the swing of things, but yes, glad to be back and sharing more of this sort of information and things of that nature. Okay, that is all for today. Thank you for listening, and I'll talk to you all tomorrow. Until then, bye bye.